we all kind of aligned on the idea of we want to have an impact on the community around us. And that's what we've been doing over the past number of years, is that we've kind of gotten out of the operating room and we're more focused and integrated with what happens in the community, what happens in home care, what happens in the patient's home. And a lot of the time, if you control the infection, if you debride the bad tissue, if you get them offloaded with proper shoes or boots or what have you, if you communicate with the home care nurses, they heal without ever needing an intervention.
And we learned very quickly that only about 10% of the patients that we were dealing with essentially required some form of surgical intervention.
We came to realize that if the specialist gets involved outside of the hospital, outside of the operating room, they can be that glue that integrates the patient journey across all of the different silos their journey occurs in. So whether it's in the hospital, whether it's across the emergency department or in the community, and to provide them that outcome that we all want to do. So we've built a team, we've built a great team. Instead of saying that we need to have a multidisciplinary team to provide limb-saving procedures, we want the patient journey to have a multidisciplinary lens. So we want to make sure that patient, when they go through their health journey, someone is thinking about them from the lens of a vascular surgeon, from the lens of an endocrinologist, from the lens of infectious disease, physiotherapist, what have you. But it all, in the current system we have, must start with the primary care physician or the nurse practitioner or whoever is out there on the front lines upstream of this problem.
I would think of family medicine as the patient's home base in the healthcare system. You know, we're doing all of that foundational work to try and have them lead a healthy lifestyle and reduce their risk of complication down the line. The nice part of family medicine is there's this longitudinal relationship that you get to build with the patient, and you help them to navigate the ups and downs. When we get a specialist involved, it becomes a very collaborative environment in which, you know, we are trying to both work together with the shared goal of helping this patient.
I personally think that the vascular surgeon should be involved in their care as early as humanly possible, because it's a huge difference between a family doctor on their own without support telling a patient, hey, you must quit smoking, you need to control your blood pressure, you need to get off the couch and move around more, versus if they also have a vascular surgeon who's also going to yell at them to reinforce the importance of these issues.
So something that I think can be very helpful to the family physician is when specialists sort of engage in opportunities to provide education to primary care. This could take different forms. It could be involvement in terms of making a presentation for family doctors at a conference, as an example, or even summary sheets that have high-yield takeaway points that help a family doctor to really distill down complicated issues to the essential signs and symptoms. These are the reasons that you should order certain tests, and here are reasons to make a referral or even a very urgent referral.
So our future for healthcare is seeing a fusion or an actual collaboration of these specialists, but also making sure that when the patient leaves, that they have this sort of continuity of care and care pathway, which will help to make sure that they don't regress or get to that devastating outcome, which would be ultimately losing the limb.
We're not necessarily centralizing the care, but certainly ensuring that the care is coordinated in a way that makes sense for the patient, in a way that we are able to have a little bit more control over what is being done, and so that we know that this outcome-based or value-based care is essentially implemented in a way that is going to prevent these patients from developing complications.
Ultimately, I think that better communication and collaboration amongst different specialists leads to not only better health outcomes for the patient, but also a better patient experience of, really feeling like your healthcare team is actually functioning as a team and not that you have a few different individual players.
So one of the things that I was saying once I learned about the CLEAR program is who came up with this. This is a great idea because it totally aligned with what I wanted to do. I always love people that want to go out in the community. And that's why anything that enables the family doctors, anything that enables the primary care physicians or the nurse practitioners or whoever is interacting with these patients, whenever we can empower them, then it will help us down the line. So absolutely, building that referral base is a huge opportunity to kind of look at medicine in a way that's so much more impactful to the communities that we're a part of.